Is Ebola really that hard to get? A Texas nurse was infected even though she was wearing protective gear. So what about the thousands of U.S. troops sent to West Africa to try and stop the spread of the disease? How much danger will they be in? Committee to Prevent Infection Deaths chairperson, former Lieutenant Governor of New York, Betsy McCoy, says we could be seeing a lot more Americans contract the virus. That's not good news.
Well, it isn't good news, and there are two types of people I'm very concerned about. The first, obviously, is healthcare workers. When the CDC says any American hospital with an ICU can handle Ebola, that's just a bald-faced lie. We know that our hospitals are not prepared to handle Ebola. Our nurses are speaking up themselves and saying they're not trained to handle Ebola. And we can see from the experiences of nurses and doctors in Africa, in Spain, and elsewhere, that the protocols for removing this protective garb once it's contaminated are so precise that one misstep means death.
But you know what bothered me when I heard about this poor woman contracting it yesterday was it sounded like the CDC was kind of blaming her, saying somebody didn't follow the protocol. Well, maybe the protocols are wrong.
Exactly. Any protocol that requires such perfection that one mistake condemns someone to a virus or death, well, that's not an adequate protocol.
Do we actually know? Because I haven't heard specifics as to what protocol they claim was violated.
No, we don't know.
So in other words, they could just be using this as an excuse for their own misstatements about how easy it is to contain Ebola.
Well, the fact is, let's look at the experience. 233 doctors and nurses in Africa have died so far this year treating patients with Ebola. Now, some of them were undertrained or inadequately equipped, but others had all the latest equipment. The head of epidemiology at the two biggest hospitals in Liberia, an epidemiologist of great renown, died the same way.
So if our health experts, with all of their knowledge about this disease and how to protect yourself from it, are capable of contracting it, what about our troops?
Well, that's another problem. Now, let's look at the situation of our troops. We're told that our troops will not be directly treating patients, but a small number of the troops will be operating mobile testing units. And, of course, people coming in, possibly with Ebola, to get tested will be in direct contact with those troops. We're told those troops will be wearing complete protective gear, but we can see the perils of removing that gear. And should we be subjecting our troops to this?
What's your answer?
I'm very worried about that. I am very worried about that. And the second is even more troubling, and that is many military are going to be involved in building field hospitals, digging in the ground, clearing the forest, right? Well, we also know, the scientists tell us, that this disease is transmitted from bats and bat feces. And so, of course, if they're not wearing full protective gear, and those soldiers will not be wearing the same kind of full protective gear, they could be exposed to this virus in the jungle.
Betsy McCoy, thank you very much.